Hi, I'm Dr. Robert Davis with Active Health Complete Relief Care, and I'm here to answer the question how Trigenics can help somebody with shoulder pain or even a frozen shoulder. Trigenics is a neurological treatment system that resets the communication between your brain and the muscles around the shoulder joint. So the problem with somebody that is suffering with frozen shoulder is that they lose range of motion. So there's some general ranges of motion that they lose when they get a frozen shoulder. So let's go through some of the ranges. You're looking at a range which is external rotation. So they like to call this the I solemnly swear position. You're not able to move your shoulder in this direction. People will also have problems even washing their hair. So putting their hand over the top of their head, reaching behind their back, and even raising their arm to the side becomes very difficult. They can't get it to about this level. Some people can't even raise it this far away from their body. So how does that happen? Well, there's different reasons for frozen shoulder. One of the main reasons is you have damage to the connection. So the connection between your brain along the spinal cord and then across the nerves, there is a lesion along the pathway, meaning there's interference that can be caused by damage in the cervical spine. It can also be caused by an injury to your shoulder, and this is an injury that could have happened years ago, or it could be some type of repetitive injury that you don't even realize that you did to yourself. So when you lose that connection, it's like you have static in the lines, and that static causes a lack of communication between your brain and the muscles around the shoulder joint. So muscles in the shoulder need to do two things. They need to lengthen and they need to strengthen. So in the different movements of your shoulder, which is external rotation, internal rotation, lateral raising, and then bringing the arm towards the body, those four motions, you're talking about four different muscles. So for this external rotation, your supraspinatus muscle needs to strengthen. When you internally rotate it, it needs to lengthen, and your subscapularis needs to strengthen. For lateral bending, your deltoids are going to need to strengthen, your latissimus dorsi will need to lengthen, and vice versa when you're bringing your arm down. Well, if there's a miscommunication along the pathway, then what's happening is when the muscles are supposed to lengthen, they're strengthening. When they're supposed to lengthen, they're strengthening. What happens? Shoulder pain. You can't move your shoulder anymore. If you or a loved one are suffering with frozen shoulder, you have chronic degenerative pain in your shoulder, and you've tried the injection, you're facing shoulder replacement surgery, you're taking pain pills, please take down the phone number below. My guarantee is that I will be able to rule you in or out of care in 2 visits. That means I will be able to know whether I can help you or whether I can't help you in 2 visits, or I don't take you on as a patient. Again, take down the phone number on the screen, mention this program. It's only going to cost you $60, and we will get you into the office as soon as possible. Thank you. Go ahead and bring your arms up. There you go. And then continue with your left arm, because your left arm can go up. Okay. And that's about it. That's my favorite color. Yeah. My favorite color. There we go. Keep going. You can help him a little bit because he's going to be weak. That's okay. And then go back down.
Nothing. I went to see a orthopedic surgeon. He said that the cartilage was gone and the shoulder needed to be replaced.
Okay. All right, we're going to do the Trigenics move on you. I'm actually going to do 4 Trigenics maneuvers, and then we'll come back and we'll see the result.
Now I got more movement.
Do you feel like you had better range of motion that time?
Now I do, yeah.
Come on. We have Diane here this morning. Diane, thank you so much for coming on the program.
My pleasure.
And what I'd like you to do is if you could please tell me the problem you were experiencing with your shoulder prior to finding our clinic.
Well, I had an accident at work, and it was pretty severe, which caused me to have 2 rotator cuff surgeries. And as you know, I was coming to you before because I had neck issues, and you were doing a tremendous job taking care of that.
Right.
So, of course, you knew I went through 2.5 years of physical therapy, and every time I would come in, I would still be complaining about my shoulder because I was unable to hold my right arm over my head.
I remember. My heart went out for you. And I did everything that we did at the time to try to help you.
Correct.
But then what happened is we got the training with the non-surgical operation, the Trigenics.
Right.
And so I'd like you to take it forward from there.
And so you asked me if I wanted to try that, and I was willing to try. I was willing to try anything because I was so tired of the pain, and you can't operate on pain pills. You can't
Right.
live your life that way. It's just not right. So after our first treatment, you took a video of me, as I recall, before,
Yes.
showing me how I could only move my arm like about here.
Right.
And then it was like a miracle. I could move my arm almost to the top of my head. It was just like great. And so I did have a couple more treatments, as I recall, and
Right.
I would improve each time. I would improve,
Right.
and it would stay longer.
Absolutely.
So,
And that was, so you had, how many surgeries did you have?
2.
And then we did, and how long did the non-surgical operation on the shoulder that I did in my office, how long did that take, would you say, the whole procedure?
10, 15 minutes?
10 or 15 minutes. And what percentage of improvement do you feel that you got after, let's say, the first treatment compared to when before it?
Oh, I would say like at least 75%, if not higher.
15 minutes.
Yes, for 15 minutes, right. And all 2.5 years of physical therapy. Never got that before.
Right. So can you tell the camera, I think your camera's over here.
Okay.
Can you tell your camera or the people that might be watching that are suffering with a frozen shoulder, or maybe they have postoperative pain like you've had, or they're getting injections, they're taking pain pills, and they just don't think there's any other solution. Could you just give them some advice?
Well, I would certainly call you. I would certainly write down the number because I did not know there was anything like this out there before you told me about it. I thought that I was doomed for the rest of my life to be having this pain. I tried injections. They did not help it. Not one bit. Not one bit did those help me. Pain pills, like I said, you really can't drive on pain pills, so what quality of life do you have? So I would recommend that you pick up the phone, leave a voicemail message. Do it right now. It doesn't matter. They'll call you back.
So how long did you have this problem?
6 months.
For 6 months? Okay. Take both arms and raise them to your side as high as you can. Okay. You could probably help him a little, Becky. Get that arm up there. Keep going. Keep going. That's awesome. You're getting there. You're getting there. Look at that. That's freaking fantastic. That is great, Gus. And I want you to take a deep breath and go all the way up. And go down.
5 minutes.
So how does that make you feel?
Wonderful.
Great. Okay.